It is estimated that approximately 40% of Americans will have some form of cardiovascular disease by the year 2030. Published peer-reviewed studies report that dairy foods and beverages may reduce the risk of cardiovascular disease. The U.S. Dietary Guidelines for Americans also reported on this research, stating that there is moderate evidence of this link.
It's a big paradigm shift for the industry to have independent scientists saying that consuming more dairy foods reduces your risk of heart disease. I wouldn't have thought in my lifetime that we would hear independent scientists saying that, but they're talking about the role and value of dairy foods in a healthy diet to not only reduce your risk of heart disease, but type 2 diabetes, and to lower your blood pressure.
That's great news for the industry and other stakeholders committed to meeting the health and nutritional needs of Americans.
Another area that we're focused on is milk fat, so that the fat content in milk and what impact consumption of fat from milk products has on your risk for cardiovascular disease. And the great news there is that recent evidence would indicate that the consumption of fat from dairy products does not increase your risk for cardiovascular disease.
Clinical trials have shown milk fat raises both good and bad cholesterol. This may help explain why several recent studies have indicated neutral or beneficial effects on risk of cardiovascular disease. The Dairy Research Institute, established under the leadership of America's dairy farmers, advances the technical research needed to drive innovation and demand for dairy products and ingredients. The Dairy Research Institute brings to light the evidence of dairy's role in meeting the health and nutritional needs of Americans. Working with National Dairy Council, this information, published in peer-reviewed journals, is actively shared with the public health community.